Hey guys, welcome back to BorderlineHR. So, borderline personality disorder and bipolar. These two disorders are often confused because they share some similar symptoms, but they are different disorders and they have different treatments. If you haven't already seen my video about the basics of BPD, please go watch it and then come back to this video. I will link it here. Okay, since now you already have kind of a grasp on BPD, let's look at bipolar disorder. Also known as manic depression, bipolar disorder causes swings in mood, energy, and the ability to function throughout the day. It's classified as a mood disorder and there are different types. This video focuses on the comparison between borderline personality disorder and bipolar disorder I and II. Bipolar disorder I involves periods of severe mood episodes from mania to depression. Bipolar II is a milder form of mood elevation, involving milder episodes of hypomania that alternate with periods of severe depression. The mood disturbance is sufficiently severe to cause marked impairment in social and occupational functioning or to necessitate hospitalization to prevent from self-harm or harm to others, or there are psychotic features. Bipolar disorder is defined by alternating periods of depression and mania that can last from days to months. Unlike with BPD, the mood swings of bipolar disorder aren't triggered by interpersonal conflicts, last for days to weeks to months rather than minutes to hours, and episodes are, by definition, accompanied by changes in sleep, energy, speech, and thinking. During times of mania, symptoms might include an excessively angry, happy, or irritated mood, more physical and mental energy and activity than normal, racing thoughts and ideas, talking more and faster, making big plans, risk-taking, impulsiveness, substance abuse, expanding, less sleep, but no feeling tired, and poor judgment. During periods of depression, symptoms might include a drop in energy, lasting sadness, less activity and energy, restlessness and irritability, problems concentrating and making decisions, worry and anxiety, no interest in favorite activities, feelings of guilt and hopelessness, suicidal thoughts, and change in appetite or sleep patterns. Although bipolar II can begin in late adolescence and through adulthood, average age of onset is in the mid-20s, which is slightly later than for bipolar I, but earlier than for major depressive disorder. The illness most often begins with a depressive episode and is not recognized as bipolar II until a hypomanic episode ensues. This happens to about 12% of the individuals diagnosed with major depressive disorder. Anxiety, substance use, or eating disorders may precede the diagnosis, complicating its detection. Many individuals experience several episodes of major depression prior to the first recognized hypomanic episode. The estimated lifetime prevalence is about 0.8 for bipolar I and 1.1 for bipolar II. Despite its comparatively low prevalence, bipolar disorder is leading cause of premature mortality due to suicide and associated medical conditions like cardiovascular disease or diabetes mellitus. Type 2 diabetes mellitus rates are 3 times higher in persons with bipolar disorder than in the general population. This is a major contributing factor to the risk of cardiovascular mortality, the leading cause of death in bipolar patients. There may be shared pathophysiology linking the two disorders, including mitochondrial dysfunction, hypothalamic pituitary adrenal dysfunction, common genetic links, and epigenetic interactions. People with bipolar type I have cycles that switch from a depressive state to a manic one. Manic symptoms sometimes include flashes of deep depression within the manic episode. This is called rapid cycling. Between cycles, people with bipolar disorder often have periods of true symptom-free wellness. This period of wellness can last weeks, months, or years, depending on the person. People diagnosed with BPD typically have more persistent day-to-day emotional symptoms, which can impact everyday life. BPD mood changes are more persistent, short-lived, and reactive to the environment, like stress at work or home. When a person with bipolar disorder is not in a manic or depressive episode, they show a stability that borderline patients lack. If a bipolar person is between episodes, they can function pretty well in the world. They can have in-depth relationships that might be disturbed by their period of illness, but when they're not experiencing episodes, they show a stability that you just do not see in a person with borderline personality disorder. Bipolar disorder is more rooted in the nervous system and more responsive to medication. Borderline strongly involves the psychological level of the mind, the way meaning is generated, in addition to the biology of the brain and nervous system. A more biological condition like bipolar disorder lacks these deeply rooted psychological aspects, or ways of seeing the world and perceiving the self and others. Mood swings of bipolar disorder are more random and less related to events than those of borderline personality disorder. Those with bipolar might have a hair trigger kind of response during an episode, whereas a borderline person has a hair trigger response all of the time. I want to read you the findings of a study about the differences between borderline personality disorder and BP2. We review a wide range of potential parameters differentiating BP2 disorder from BPD, while accepting that a small percentage of individuals may have both conditions. The seemingly most useful discriminating domains would appear to be phenomenological differences in terms of mood and age of onset. The majority of BP2 hypomanic episodes are euphoric anxiety-free states and in sharp contrast with the hostility, irritability, and anxiety-weighted periods experienced by those with borderline personality disorder. The majority of depressive episodes in those with a BP2 condition are melancholic in nature and contrast with the non-melancholic reactive depressive episodes experienced by those with BPD. BPD, being based in personality style, would appear to evolve from childhood and adolescence, whereas BP2 is more likely to have a sharp onset period, i.e., the individual reporting episodes of hypomania and of depression emerging when no such distinct episodes were previously present. I've made a chart for you detailing what we've learned about the differences between borderline personality disorder and bipolar disorder. So, in conclusion, BPD is a personality disorder, while bipolar disorder is a mood disorder. BPD causes people to feel, think, relate, and behave differently than people without the condition. Bipolar I and II are mood disorders that can cause severe mood changes. It's possible to have both, but it's not very common. Each is a serious illness, and those suffering need to seek out proper treatment because both illnesses can be successfully treated. Too often, people with BPD are treated for depression or bipolar when it is a more complex problem. It's essential for people with BPD to seek out a specialist. A lot of general therapists do not do a good job with this patient population. It's like sending someone who needs cardiac surgery to a general surgeon. A bipolar person walks from fire to ice, with periods of symptom-free normality in between. A person with BPD walks with one foot in ice and one in fire at the same time, all of the time. Thank you for watching. Do you have any questions you'd like me to answer, or borderline-related topics you'd want me to cover, or experiences you'd like to share? The comment section is yours. Please also don't forget to save the like and subscribe button from their respective feelings of abandonment, and see you next time. Be kind to one another.